All right, hi everyone. We're going to get started. Thank you for joining the School-Based Health Alliance for our webinar titled Race, Equity, and Inclusion in School-Based Healthcare. This presentation will lay out some of the measures that schools can take to mitigate the effects of adverse conditions that can undermine academic achievement. Practical suggestions regarding actions that schools, districts, and other public agencies can take to support schools will also be presented. Before we begin, if you are viewing as a group, please go to the chat window in the chat icon and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. Also, please type in the chat box how you found out about this webinar. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend the majority of their time, in school. When health and education come together, great things happen. Attendance improves, conditions like asthma and diabetes are better managed, behavioral health issues get quick expert attention, and we all know that healthy students make better learners. Now we have a few housekeeping reminders. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the chat tool located in your Zoom control bar. Following the presentation, our President Robert Boyd will be asking our presenter a few questions, and then we will address questions from the chat box. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 1 to 3 business days. Please also visit the School-Based Health Alliance website for additional archived webinars for topics such as the ones you are viewing on your screen. Now I'm going to hand it over to our President, Robert Boyd, to introduce our presenter for today.
Thanks, Maddie, and hi, everyone. I pray that you and your families are well and safe wherever you are. Thanks for joining us. My name is Robert Boyd, and I'm the president of the School-Based Health Alliance. Today, we kick off our summer series, and we know that everyone is webinared out, so we're especially grateful to the 1,000 of you who have registered for today's event. I have the distinct pleasure and high honor to introduce Dr. Pedro Noguera. Pedro Noguera is the Emory Stoops and Joyce King Stoops Dean of the University of Southern California's Rosser School of Education. Prior to USC, he was a distinguished professor of education at UCLA and has held tenured professorships at NYU, Harvard, and UC Berkeley. He advises the states of New Mexico, Washington, Oregon, and Nevada on education issues, and he has been a trustee of the State University of New York, SUNY. Dr. Noguera is the author of over 250 research articles and has authored or edited over 25 books, including the pivotal Race, Equity, and the Future of Public Education. His most recent book is The Crisis of Connection: Roots, Consequences, and Solutions. A sociologist by training, he earned his BA and master's degree from Brown University and his doctorate from the University of California at Berkeley. He also holds 7 honorary doctorates. Full disclosure, I've known Pedro for over 40 years. We met in kindergarten. Seriously though, we met in the 1970s at Brown University, where we were both student activists fighting for equity in admissions, financial aid, faculty hiring, and against apartheid. We've been in the struggle for many years. Let me just tell you that we knew the day Pedro walked on campus that we could expect great things from him. And all I can tell you folks is he's not done yet. So please, let me introduce my friend and my brother, Dean Pedro Noguera. Pedro?
Thank you, Rob. And great to participate in this event with you and to have a chance to speak to this audience out there. I'm in Los Angeles where it's still early in the morning, but I'm looking forward to a chance to speak to all of you. I want to make sure that I can share my screen so I can get my, yep, there it comes. My slides up for you. And Can you see it?
Yep, we can see your screen.
Great. Okay. So it is, I think, apt that we are talking about health at a time that we're in the middle of a pandemic, and everyone is so concerned about what it means to reopen schools during this period. We know that the pandemic has exposed the deep inequities in our society that were already present, and now they've been exacerbated by the pandemic, with so many people out of work, with large numbers of people infected, particularly people who are most vulnerable across the country. Many of them are the so-called essential workers. I say so-called because it's ironic that if you're essential, that you're not a well-paid worker. And we know that many of those are not well-paid workers. And so as we think about schools in this context and think about health of children, we also have to think about the health of the adults who work there, because in many cases, they will even be at more risk than the children themselves as a result of this virus. So I want to start by getting you to just think about a few questions and whether or not this pandemic represents an opportunity to start doing things differently is, I think, first on the list. We know that before the pandemic, schools were already characterized by deep disparities based on race and class and language and culture throughout the country. So-called achievement gap is largely a manifestation of inequality. Can we work to make schools better than they were, less unequal, more responsive to the needs of students after they return, after they reopen? To do this, we're going to need a shift in the paradigm, shift in the way we think about the needs of kids. For too long, we've thought narrowly about achievement as measured by test scores and ignored things like health. And right now, we know that kids who are sick, kids who have mental health challenges, and kids who have social challenges related to poverty are kids who will not do as well. So we're going to need to think differently about how we respond, think in a more holistic manner. To get there, though, we're going to have to really think about our schools and the particular challenges facing our children and the communities we serve, because equity issues are not, although they're common patterns across the country, each school faces its own unique challenges related to the people you hire and their skills and their ability to work with kids, related to attitudes, beliefs, expectations. All those things can become barriers to achieving equity in the work we do. So as you think about my presentation over the next few moments in the conversation we're going to have, I want you to think too about your school and how this relates to your needs and the particular challenges you face. And then that relates to the last point, which is how do we build the capacity of our schools and the people who work there so that we're better able to do this work successfully. So let me start with a quote from Hugh Vasquez, who is an officer at the National Equity Project. And he says, since we know that disturbance is required for change, and there's no doubt that disturbance is happening as we speak, the question is, are we willing to use this opportunity to create the kind of educational system we want? We have learned that if we're going to change a system, we as individuals first have to see what that system is producing. Then we have to engage with others to design something different. And finally, we have to act. So we've had this moment when we've been out of school, this moment of quarantine, of lockdown in many parts of the country. Have we used this as a chance to reflect on what we've been doing and to envision new possibilities? These are the questions that he was raising. I think they're quite pertinent. And they're very similar to the questions that come from Paul Reville. Paul Reville is the former commissioner of Education in Massachusetts, currently a lecturer at Harvard University. And he says, how do we make our school, education, and child development systems more individually responsive to the needs of our students? Why not construct a system that meets children where they are and gives them what they need inside and outside of school in order to be successful? Let's take this opportunity to end the one-size-fits-all factory model of education. I would think about that last part, the factory model of education, if that sounds familiar. And before you answer, I want you to reflect on this question. How much do you really know about the children you serve? How much do you know about their needs? What do you know about their motivations, their interests, their desires, their dreams? I'd say too often what we know about kids is we know demographics, we know race, we know language, we know test scores, but do we really know them as people? Knowing them, knowing their families, knowing their community is key to figuring out how to serve them. When we don't know them, what we do is rely on assumptions, which are often rooted in stereotypes. And so I want you to think about that, because if we're going to design schools and systems that are more responsive to the needs of kids, we can't only focus on how to get the infrastructure in place, make sure there are health centers that function well at our schools. That's part of the work. But then we also have to think about who we serve and how we're going to serve them. What are the skills that our staff will need? How do we ensure that they will know how to demonstrate cultural competence in delivering care and in working with families and communities? Because without that, even when you design a system, you may find that you miss those who need those services most because we don't know how to communicate. We don't know how to build relationships that are rooted in trust. So this is the essential part of the work, I think, that too often doesn't get the attention it needs. As I said previously, the need for change is clear. Change in our systems, change in our schools, the disparities what's important to keep in mind about the disparities in education is that they mirror the disparities in health. And I'll talk to more about that in a moment. But the fact is that many of our kids who are especially from low-income families and not doing well in school also come from families that have higher rates of asthma, diabetes, heart disease. They go together. And unlocking that connection is key to improving not just academic outcomes, but health outcomes and developmental outcomes for children. In many of our schools, we are most likely to punish the kids with the greatest needs, and disproportionately those are children of color, particularly Black children, particularly boys. I often say we are most likely to punish the kids with the greatest needs. Think about your school. Who do you suspend most often? What do you know about those children? In many schools, they are disproportionate children with special needs, children who are homeless, children who are in group homes or in foster care. What we know is that very often the needs affect the behavior. If you address the behavior but don't respond to the need, chances are the behavior is not going to change. And so we've finally woken up to the fact that suspending kids, the same kids we're trying to serve educationally, is not an effective strategy because they're not in school. But what's more is, more often than not, those kids, their behavior doesn't change because they've been suspended. In fact, they may behave even worse because now they're even less connected to school. So what are you doing to build strong relationships? Because we know that relationships are vital to learning and vital to better outcomes. Lawrence Kohlberg, a psychologist, wrote many years ago that the goal of discipline should not be to teach children to avoid punishment. It should be to teach children to do what's right even when adults aren't around. I want you to think about that, because what we have to do is connect our educational strategies to our health strategies, to our focus on building strong, positive relationships with children and their families. Again, we have to broaden the focus. We need a more holistic focus on children to do that work. And we have to realize that pressure as a strategy for kids, particularly kids who've experienced a lot of stress and a lot of failure in their community, is not going to be an effective motivator. We have to rely on hope instead. We have to demonstrate to kids that through education, they can in fact improve their lives, help their families, help their communities. And so I want you to think about the strategies your school relies on now to carry out its work of serving children. You're a school that empowers kids, empowers families, that builds trust, or is your school characterized by a more punitive culture, a culture where there's judgment of families, where there's condescending attitudes, where there's a punitive attitude towards children. Those environments tend not to produce good outcomes for kids, and they tend not to be the kinds of schools that are successful academically either. As we know, we have very high poverty rates in the United States, some of the highest amongst advanced developed countries, and those rates are growing now during this pandemic with so many people out of work. Food lines are growing. Many schools are food distribution centers right now because we don't have a safety net in this country for people, much less children. And so I want you to think about that, because what it speaks to is the need for a more holistic approach to educating kids. Health has got to be central, but so does nutrition. So does mental health. So does clothing in some schools, because we have to think holistically about children's needs. There are a number of schools that have adopted a community school model to address and to mitigate the effects of poverty. And for those of you who have community schools, it'd be interesting to hear how well they're working, whether or not you have the resources you need. For those of you who don't, I want to encourage you to think about who your partner should be in your work. And all schools need partners, because schools can't do this work by themselves. Universities can be partners. Local businesses, nonprofits, churches can all be partners in this work, and certainly hospitals. So if you don't have the ability to build your own health centers, do you have the ability to partner with health providers that can serve your children? We have now become more aware of the way toxic stress and trauma impacts children. We know that adverse childhood experiences such as divorce and violence impact children, and the more of those you have, the more adverse the consequences on children. We know that it impacts learning as well. Everything from attention to memory to the ability to control your impulses, all are affected by stress. And we also know that building strong relationships with children is one of the key strategies we can use to countering the effects of toxic stress on children. So in addition to providing healthcare, I wanted you to also think about how relationships can serve as a health strategy. This is so important because in many parts of the country, the health needs of our kids are in distress, particularly now because of the pandemic. This is a map of Los Angeles. I'm showing it just because I think it accurately reflects what's going on in many parts of the country today. Los Angeles is one of the most unequal metropolitan areas of the country. Is also the largest. Right? We have more people in Los Angeles County than there are in 38 states in the nation. What this map shows is where the Human Development Index is lowest. And lowest means that children are more likely to suffer from health conditions in these communities. They're more likely to be poor. They're more likely to be in environments that are unhealthy. And those of you know the LA area, these areas are concentrated in South Central LA, in Compton, in Watts, the poorest communities. What we also know is that these areas have the highest numbers of pollutants. We are, right now, for a little while during the pandemic, when there was less traffic in LA, we saw the quality of air improve. We're back up again. And once again, and this was particularly true on the 4th of July when there were so many fireworks, air quality is an issue that particularly impacts children. Poor children, particularly poor children of color, have much higher asthma rates. Asthma is linked to chronic truancy or chronic absenteeism from schools and to lower health outcomes. We know that, again, as you can see from the data, that Black children in particular are affected by this. And that's a national pattern that's not unique to Los Angeles. And then this has an impact, again, also on education. These are the college readiness rates. And as you see, the darker schools in the South Central and also in the Antelope Valley. Antelope Valley is where there are many prisons in the LA County, and turns out that many families of inmates move to the Antelope Valley. Those areas have higher rates of homelessness, higher rates of poverty, and more kids in foster care. Point I'm trying to make here is that you need to have a clear sense of your community and the unique challenges faced by your schools. You need good data on what's happening to children and families, because health outcomes impact learning outcomes. And this is the point I want to reinforce over and over again, because as we can see from this data, the same kids who are most likely to suffer from health conditions are also more likely to be suspended, more likely to be absent, and less likely to perform academically. And the patterns that we see in Los Angeles are evident in cities and rural areas across the United States. So the real challenge is, can we promote wellness and academic success? And again, I want to encourage you to think of these as linked. Hungry kids don't do well in school. Sick kids who miss lots of days don't do well in school. Kids who need eyeglasses will have trouble reading. This seems obvious and clear, but ask yourself, does your school acknowledge the health connection to learning? In many of our schools, that's not the case, because we have focused narrowly on academic achievement and ignored these other needs in children. That's not the case all over the world. New Zealand, Iceland, Scotland have recently passed what they call a wellness budget. And the initiative, as you can see, has 5 priorities. And that includes ensuring that the move towards a sustainable environment and economy, supporting access to information, and closing the digital divide. In their case of New Zealand, making sure that the indigenous population of Maori and the Pacific Islanders have adequate income and health, as well as reducing child poverty and mental health. Now, I know that we don't live in New Zealand, but I want you to see what it looks like when the national government adopts these priorities. That's not the case in our country. As we know, we're still debating whether or not we should even have the Affordable Care Act. We still have far too many kids who don't have access to good health care, nor their families. So what we're after is wellness, but we are a long way from that in this country because we haven't adopted policies that would reinforce it. To begin to get there, we have to make equity, the pursuit of equity, central in education and in our work with children and families. And that starts by acknowledging, addressing differences in kids, because not all kids have the same needs. It means responding to the academic, the social, and psychological needs of kids, particularly now during this pandemic. It's a commitment to fairness and equal treatment. And I want you to think about this last point. It's about a willingness to speak out when we see that kids are not being treated fairly and being denied basic opportunities. Speaking out is of vital importance because we don't change outcome for kids if we simply go along and ignore when we see kids being treated unfairly. And I know that this sometimes means challenging our colleagues on speaking up in ways that may put our own jobs in danger. But if we don't do this and we don't find ways to do this, what we risk is simply being complicit in the production of failure and in seeing kids basically become even more vulnerable. Some of you have seen this. This is a wheel on social emotional learning developed by CASEL, the Center on Social Emotional Learning at the University of Illinois, Chicago. Point is that they've made is that when we treat the social and the emotional needs of kids as central, it actually does begin to have impact on not just health, but also on education, because it helps kids to acquire the ability, more self-awareness, the ability to manage their emotions, make better decisions, form better, stronger, healthier relationships with peers and with adults, all because they are more and more aware of who they are and their place in society. This impacts classrooms, schools, and communities. So what we can't do is allow social emotional learning to become nothing more than a slogan. I want you to think about your school, think about how aware the educators are of the need to put a priority on the social emotional needs of children. Because when we do that, what we see is outcomes for kids improve too. This means, and many of you have seen this diagram before, that we've got to be clear that treating everyone the same is the opposite of doing equity work. You can't treat them all the same because they're not the same. Anyone who's a parent of more than one child knows that because your own children are not the same. I was just talking to a colleague who has twins, identical twins. And I asked how they're doing during the pandemic. She said, one is thriving because he's an introvert. He likes Zoom. He likes working at home. Her daughter, our other son rather, is an extrovert. He misses his friends. He likes to be in the class, interacting with his peers. He's not thriving on Zoom. So if you have those kinds of differences amongst identical twins, imagine our classrooms where we're serving all kinds of children. What we often don't see when we talk about equity is the great inequities in our society. Many of the kids that we call gifted, many of the kids who are in private schools, their primary gift is affluent parents. Affluent parents with education who are able to advocate for their needs. Right now, those parents are thinking about homeschooling because they know their kids won't be in school, so they're going to make other arrangements. They're going to get private tutors. They'll hire a teacher for their kids. They will make sure their children's needs are met. And so what does that mean? It means the kids who don't have those kinds of parents are likely to fall further and further behind. Several studies have already been released on the impact of learning loss on our children. So what we've got to do is think about how to eliminate the barriers. That's where equity work lives. And we eliminate the barriers, first of all, by identifying what they are. So in many schools, the biggest barrier is complacency. Complacency because we've grown accustomed to the patterns, we accept them as normal, and we ignore the ways we might be complicit in them. In schools where we're blaming kids, blaming parents, or even blaming politicians for the problem, often what it means is we're not accepting responsibility for what we can do to make a difference. And so I want you to think about not what you don't control, but the factors you do control to impact the lives of your students. Implicit bias is often a barrier because it results in lowered expectations. It results in judgments that influence the way we see those we serve. And it produces strained and weak relationships. In schools, the tendency to see teaching and learning is disconnected. So teachers take no responsibility for learning outcomes. The punitive mindset in grading, unequal access to external support outside of school, all of those contribute to inequity in schools. And then lastly, ignoring the basic needs of our kids. Again, we think about Abraham Maslow and the hierarchy of human needs. Maslow told us many years ago that at the base of that hierarchy was the need all children had for nutrition, for safety, for health, and for love. And Maslow argued that without attention to the basic needs, it would be hard for children to experience healthy human development. Think about the children that you see struggling right now in your schools. Chances are you will see basic needs that are not being met. So I want you to think about the challenge in your school, in your district, and the primary equity challenges that you need to address. As I said earlier, each school is faced with their own particular challenges. I do a lot of work here in Los Angeles, but I'm originally a New Yorker. New York is seeing a huge rise in the number of students who are homeless. What we need to recognize is homeless children are going to need even more support because very often they're in a setting where distance learning is not very easy to pull off. So who do you serve? How do you serve them? Let me pause now and engage my friend and colleague, Robert Boyd, in some discussion. And if need be, I'll come back to my slides, but I want to make sure we have a chance to discuss some of the issues I've raised and hear your questions as well.
Yeah, thank you. And to everybody listening, put your questions in the chat room or in the Q&A, and our staff will relay them to us. First, thank you. And thank you for lifting up the community schools model. We at the School-Based Health Alliance support that model, just as they recognize that it really can't be a community school if there's not a school-based health center embedded in it. And we all believe that all Title I schools ought to be considering the community schools model, if not adopting it outright up front. So thanks. Everybody's talking about reimagining. So I'm going to kind of go off script. Everybody's talking about reimagining. You know, we talk about the factory model of education or the agrarian model of education. We could go another year before we have a vaccine and another year before we get back to in the school building learning. Everybody thinks schools closed. A lot of them did not close. They just closed the school building and they tried to marshal on. As you're thinking about reimagining schools in the future, what do they look like? What kind of considerations need to be taken into account, and what kinds of approaches do we need to be thinking about a year out, 2 years out, 10 years out?
So that's a great question. And you know, one of the things I want the listeners to think about is, to what degree have you used this moment, the quarantine, as a chance to rethink your own lifestyle, right? I know that's been an issue for me personally. I've thought about, I actually, despite all the other challenges, I've enjoyed not traveling as much. I've enjoyed being present more with my family. I've enjoyed being able to have more control of my diet, eat better, and exercise more. So many people are reporting that they are trying to use this moment as a way to change their own lifestyles. I think similarly, we have to think about schools in the same way. One of the things that we've got to do when we get back to being in person is we've got to recognize that bringing health into the work has got to be more central. We've got to check in with kids. Many kids have been isolated. Some kids have been under great stress. So one of the things we have to do is make that kind of work much more central to our schools. We've got to make, for younger children, play more central, the arts more central, music, because we know that holistic, well-rounded education is what kids need. It actually affirms them, affirms their development. My colleague Howard Gardner often points out, it used to be common in this country for every kindergarten classroom to have a piano, and for every kindergarten teacher to know how to play the piano. But across the country, you go to many schools, you don't see pianos anymore. And it's not because kids don't love music. It's because we've somehow forgotten how important music is to a foundation for learning. So my hope is that as we return to school, we return to something that's more holistic, that's more balanced in the approach, that we make relationships much more of a priority. Less focus on achievement, more focus on engagement. Engagement is key if we want to improve outcomes for children.
So one of our listeners asks, what's the specific first step for that school or that district that wants to focus on the whole child?
So let me describe such a school. Here's one, if you could see the image here. This is Hollenbeck Middle School in East Los Angeles. It's in a low-income community. These are all English learners, all recent immigrants. Many of those kids are undocumented or children of undocumented parents. These are the kinds of kids that in many places would not be thriving academically, but that's not true for them. This is a school that has a health center on campus. It's got that well-rounded education described. This is a 90-minute algebra class. These are 8th graders, and some of you might notice that they're out of their seats and they're working together. And the teacher's so good she can stand in the back and talk to me. Because she's not in control of the learning, the kids are in control. And that means they're not simply learning math. They're learning how to work together. They're learning how to cooperate, how to deal with conflict when it arises. And the teacher can differentiate support to her kids because now she can move amongst them and facilitate the learning. I bring this up as an example because when we see examples like this in a setting like this, it's a reminder that this work is possible because it is happening in many places. Unfortunately, in education, we don't learn from places like these. And so if it's not happening in your school, I would encourage you to find out the Center for Community Schools, Jose Munoz. I know that Rob knows them. They've done great work, and they can point to places throughout the country where it is occurring.
You talked about toxic stress. If anything, this pandemic is brought about stress in people that might not have had anxiety or depression or other kinds of mental health conditions before. I came over from the school safety movement, and I've seen schools that have gone through mass incidents that the entire community is in shock, toxic shock. We have a scenario where we could see 100,000 K-12 public schools restart back in their buildings or start a new school year. And all it seems anybody's focused on is washing hands and how closely students should be sitting next to each other. And it doesn't seem like anybody's focusing on the mental anguish, the mental health issues, not just of the students, but of the staff, of the teachers. Those entire communities have been affected. What are your thoughts on that?
Yeah, this is a huge problem. And I know there are some states, because of the politics, and we've allowed this issue to become so politicized, they're going to follow the administration's order to reopen, even though the administration has given no guidance on how to do so, and they will push for it. We should know that there are some countries out there that have already done that and done it. Some have done it well, and some have done it very badly. And for example, Israel, where they've seen an outbreak of more cases because they did not take the right precautions. So you're absolutely right that the risks are great, and the risks are not just the risk of getting the virus, but they're also exacerbated by the stress and the mental health challenges that have accompanied the pandemic. So those of you who are principals and superintendents out there, I really want you to be aware of the fact that the logistics of reopening are not the only issue. The other issue is how do we take care of our staff so that they are not going to be so afraid or so at risk that they end up dropping out, quitting, and you end up not having enough people to work in your schools because you can't assure their safety. So really thinking about the people who work for you is going to be really critical if you're going to be able to ensure that schools can reopen safely. Now, I should also point out that if you're in a rural area, and many rural areas, you know, the virus infection rate might be very low, it may not be as much of a concern. And you can do this more carefully. But we have rural areas in California, Imperial Valley on the border, which has a 25% infection rate. And they are experiencing this virus at a level that many communities across the country are not. So you really have to know your community, know the data, the science does matter, and it should guide our approach.
So who should be making the decision on what happens with schools this fall? I mean, is there a common solution to everybody, or, you know, is this a community by community, school by school, district by district type of a decision?
So ideally, we should look to the Centers for Disease Control for some guidance. We should look to our governor's office for some guidance, and depending on the state, you can do that. Or you should be looking to your county health departments. And in you know, various parts of the country, I was listening to the reports from Hidalgo, Texas, where the county commissioners challenging the governor and saying our schools cannot reopen. In fact, we need to be under lockdown because the infection rate is so high. And so we see direct challenges because this issue's become politicized, and we don't have a clear and consistent message coming through. So I would say the people who are closest to you in authority, particularly in the health departments, probably know best how to approach reopening and what kinds of procedures and precautions are going to be needed. But it's sad that we're in this place where we're getting conflicting messages all the time.
Well, so you talk politics. This is an election year, and many of us are used to having our votes taken for granted. We're spending as a country trillions and trillions. I never thought I'd use that word. trillions and trillions of dollars on a range of issues, bailing out companies that don't need bailouts and giving tax breaks and the like. What should be the educational priorities of this current Congress and this next administration? You know, the current Congress dealing with immediacy of school reopenings and then longer term. And how do we get them to think about the whole child?
You know, it's so ironic that there's still talk of trying to get rid of the Affordable Care Act at a time like this, you know, and especially when there's no alternative that's been laid out. You know, so my hope is that after this election, there will be a renewed commitment to healthcare for all. You know, one of the things we've seen, especially in this pandemic, when people don't have good healthcare, they will continue to go to work because they have to, which means they will then risk infecting others because they're carrying that virus, but they feel the need to go to work. So healthcare for all is the only way to ensure our healthcare. But beyond healthcare, we got to make sure that people don't lose their houses during this period. And you know, some communities have enacted a moratorium on foreclosures and evictions, but you know, without a bailout coming from the federal government, it'll be hard to sustain that too. So what we don't want to see, but we are likely to see, is a rise in homelessness and a rise in the number of people who are on food lines. We have a church in my community, and the line for free meals is growing every day, and it's a very diverse group of people online waiting for food. So, you know, leadership is going to be needed to make sure that the people of this country are back at work and are able to make it through this period until we're able to bring the economy back up. But I think right now, unfortunately, we're in a period where there's a leadership vacuum.
Yeah, and some of the leadership is pushing for this reopening of schools regardless, or we're going to cut back funding, whether that's a federal approach or even some of the governors are approaching it that way. But we know with the rise of homeless youth in cities and the fact that many families of color that are in the low-income categories work at jobs that require them to go to work or lose the job, we know that our children, as you've pointed out, benefit from relationships and benefit from that social interaction in the school. But we also have the flip that our kids are the ones most vulnerable. Kids of color are the ones most vulnerable to the disease. Communities of color are the most vulnerable disease. What do we do? How do we, I know it's not a fair question, but how do we say to that parent, no, you can't send your kid back to school, even though you might lose your job if you stay home with them? How do we balance that? What do we do?
Yeah. These are tough questions you're posing, Rob, because you're right. I mean, we've woken up to the fact that you can't really reopen the economy. You can't really send people back to work if they can't ensure that their children be safe and be supervised someplace. Even if they're not in school, then people say, well, what about childcare? Right? We need something to make sure that our children are supervised. So I haven't seen creative solutions to this yet at either a state level or even at a local level. There are some businesses that are trying to find ways to offer childcare, but even that, you then have to worry about, are those childcare settings going to be safe? So, you know, these are difficult issues that we're grappling with now, and I don't see an easy answer other than bringing the infection rate down. You know, the rule of thumb is if you can get it below 5%, then you can reopen schools and you can do things more safely. But many parts of the country, it's well above 5%. And that's the real dilemma.
So one of the questions from our listeners is, are there any schools that are out there triaging kids that need to be in school the most? So that instead of just saying they're going to reopen, I'm interpreting what this question is, and instead of just reopening the school for everybody, we identify the children in the school that are at most risk. the homeless children, the foster kids, the children whose parents are forced to go to work or lose their jobs. Is there any thought, and do you know of any schools or school districts that are employing that kind of thinking?
Yes, there are. And so here's a school doing just that. This is a school in Los Angeles also, Social Justice Humanitas Academy. It's located in the San Fernando Valley, Pacoima. Again, very low-income community. They are on their own because they have the flexibility as a school to do this, thinking about, okay, if we have to, there are some kids who need to be brought back. And so they're thinking, okay, let's prioritize our kids, for example, with special needs. We know that many of our learning disabled kids are not doing very well through distance learning. They need more support. They're also thinking about English learners. They're thinking about seniors and what kind of support they're going to need during this last year. So they're making those decisions. Now, this is a school that has a much more comprehensive approach. What I've been describing, they've got it. They typically, during a typical year, they do community building. They start the year with that. They check in so that with students, particularly the entering ninth graders, to get to know them, so their teachers get to know them. They do this before the school year officially starts. And when I asked the principal, how do you get the kids to come? He said, we just tell them they have to and they show up. And that's key, because too often what we do is we rely on compliance instead of going the extra mile to make a difference. And this is a school that does just that. They involve teachers in collective decision-making, so that teachers are making decisions about the schedule. Teachers are making decisions about the curriculum and planning together. And so one of the reasons why they have very little teacher turnover, because teachers feel respected, teachers feel heard, and that makes a huge difference in the place where you work. They have partnerships. In addition to the health partnership, they work with a group called Educare, which provides social support to kids and counseling to kids because they know that the school can't do it on their own. It is the only school in Los Angeles where students evaluate the teachers. And that, I think, is, you know, at universities, typically students can do that. They do it there too, because they know that the feedback students provide gives the teachers useful information. It's something I want to encourage other schools to think about, how you can allow student voice to be a resource for you in improving the way in which you serve your students. And so despite the fact that it's 100% low income, large numbers of kids who are English learners, it has the 4th highest graduation rate in Los Angeles and a 95% college enrollment rate. So, you know, this is an example of a school with that holistic model. They are, in fact, planning in the way that I described of how to prioritize the needs of kids. Sadly, they're doing a lot of this on their own. And that, I think, is really unfortunate, because there are a lot of schools that need this kind of guidance and support.
The questions are really starting to roll in, and folks do have a hard stop at 1 o'clock, so get those questions in. I'm going to flip the script a little bit again. Somebody raised a question about indoor air quality, which reminds me of all of my work in school safety. The average age of a public school facility in this country is north of 50 years old. You know, I've built a lot of stuff, Pedro, and the systems that go into buildings like heating, ventilation, and air conditioning, or roofs, they're designed for a 20 to 30 year life. And in some of these 50-year-old buildings or older buildings, Baltimore comes to mind right now, Philadelphia, they're still keeping them together with chewing gum and baling wire to keep things holding together and working. What about the inequities that exist around infrastructure for schools? I mean, we're talking about infrastructure programs, ready-made projects to build roads and bridges and buy new school buses to drive kids to a 50-year-old school. What message does that send to our children about the value that we place on where they spend the majority of their time?
No, these are gross inequities that we've lived with for a long time in America, and we see it. You know, you go to an affluent suburban community, you see well-built schools, swimming pools, computer labs. And then you go to inner city or rural schools where none of those kinds of resources are available, and sometimes not even science labs, not even libraries. So this is these inequities just in learning opportunities and the infrastructure itself are gross, they're apparent, and they're very American, because America is one of the few countries that deliberately spends most money on the wealthiest kids and the least on the poorest kids. And money matters. The only people who say money doesn't matter are people with lots of money, usually. But aside from the infrastructure, where I thought you were going is whether or not outdoor learning is going to be a possibility. And there are many schools. Now, California, we have the advantage of the weather, where that is feasible in many places that are not overcrowded. Not feasible in Los Angeles because our schools were already overcrowded, but in many communities, you can do some learning outside. You might be more concerned about the sun than anything, because people get sunburned. But that's not going to work in the Northeast. It's not going to work in the Minnesota and places like that. So we have to devise solutions that are appropriate for our context, our environment. And so it's not a one-size-fits-all approach that's going to work here.
Yeah. Yeah, the other issues of the outdoor learning, it's not a long-term solution. It's even not a long-term solution in California. I mean, it's possibly repurposing buildings that are closed, like old shopping centers, or things like that might also make some sense. Rethinking how we're utilizing resources in this country. Let's talk about our teachers. There's a lot of teachers on the call today, and what are your thoughts for the stresses that they're going to come back into? I mean, we're expecting. I mean, you and I are both parents, grandparents now, and asking. I always get frustrated. We always lay. My mom was a public school teacher. We lay on the backs of teachers the success or failure of the American public education system. And that's like blaming the United Auto Workers for the failure of General Motors. I mean, they didn't design the cars. They didn't, they're playing the hand they got dealt. And our teachers aren't being dealt a very good hand right now. What are your words of encouragement for teachers?
Well, my words are stay organized, stay vigilant, stay together, because I do fear that, especially in states where there aren't unions for teachers in the South, that they will be asked to risk their health and their lives by being forced to go back to school and be placed at risk. Now, not long ago, 2 years ago, we saw strikes in places like Arizona, West Virginia, Oklahoma, red states where the teachers aren't unionized, and teachers were fed up with the low salaries, fed up with the poor conditions. I'm not saying that you need to strike, but you need to be ready if you feel as though, as teachers, you're being asked to do something that puts you and your life and your loved ones' health at risk. So I certainly feel for the teachers right now, because now teachers are being called essential workers, and once again, not given the protections needed to ensure their health and safety.
This is, if you thought that other question was unfair, I'll throw this one at you. Everybody's talking about the next administration. Is there a role for Pedro Noguera in the next administration? I mean, should somebody on this call be starting the petition for you to be the Secretary of Education? Because clearly we need somebody in that role that knows what they're doing and understands the pivotal role that education plays in the reignition of the economy and the success of the country.
Well, honestly, that's not a job I've been thinking about, but I do think about what kind of person and what kind of leadership's needed there. Imagine if Betsy DeVos, instead of just saying, reopen schools, was working with governors to issue very clear guidelines on how to do it, where to do it safely, where we shouldn't do it. That would be, we would be celebrating her leadership right now. but it's not happening. So there's the vacuum in Washington is a big part of the problem. My hope is that the next administration, I'm hoping that it'll be an administration that takes these issues more seriously, that doesn't allow the United States to have more cases than any other nation in the world right now, which is where we find ourselves, will be more willing to rely on the science, turn to mental health professionals, and work with educators to do the right thing. And I think everybody wants to make sure that we come out of this as a country whole and better off than we were. But we're not going to do it by just pointing fingers and blaming and attacking each other. And unfortunately, that's where we are right now.
Yep, yep. Somebody asked an interesting question. They said that they're a member of a number of social organizations and civic-minded organizations. You know, whether it's Greek organizations or Coalition of 100 Black Women, it's links, etc. What role do organizations like that, and what responsibility and obligation do organizations like that have to participate in a community school type model, in supporting their local schools?
That's a great question, because where we don't have the school-based health centers in place, we need to tap into community resources to support schools. We need to, so if you have civic organizations like the one you described, there are a lot of schools that need help with tutors and mentors. So I'd encourage you to reach out to your local principals and superintendents to forge those kinds of alliances. As I said previously, we need colleges and universities to step up to work with schools, and local hospitals and clinics and churches. We can't allow the schools to do this work by themselves. That's what we've done in America. And that's part of the reason why our schools are so overwhelmed and why our teachers are overwhelmed. We basically ask teachers to be social workers, counselors, surrogate parents, and many of them are overwhelmed. And it's unfair. They often don't have the training to do those other jobs. We need actual social workers and psychologists and counselors working with our schools, supporting our kids and supporting the families. And where we can't get trained professionals, let's get volunteers in to do some of that work to reinforce our schools. And
we need more. We've only got, what, 45,000 school nurses for 100,000 schools, and 30,000 psychologists and, you know, counselors. We just don't have enough quality professionals, licensed clinical professionals that want to work in schools. They have other options, and we need, you know, a resurgence of, I mean, you know, our parents' generation, you know, being a teacher was a great job. I think I recall both of our dads were cops. Well, they didn't become a cop because they loved policing. They became a cop because it was a well-paid job, and it had benefits, and they could pass that on to their children. We need to provide better salaries for people who work in school, and better opportunities for them, and we need more of them. We've got to have an aggressive campaign to recruit more people to work in schools. So when you are the Secretary of Education, we will all be at your doorstep reminding you of this conversation that we need to have to move our nation forward. I want to thank you. Any last words for us before we let you get? Because I know you're up against the deadline too. I just want to encourage those of you listening to do two things. One, to work where you are, to be resourceful, to work closely with your community, to provide the supports your schools need, but also to speak up and speak out. Don't be silent now about what's happening in this country. We've seen a movement for racial justice sweep the country. That movement needs to include justice in education, justice in health. And I encourage you to speak out, let your voice be heard. So Rob, it's great to see you again. Great to work with you on this. I'll talk to you soon.
All right. You take care. Thank you all.
God bless. Maddie, have you got any last words for us?
Yeah, I just launched the evaluation questions. If you could just take a minute to answer those, your feedback would be really vital. Thank you.
So long, Rob. Take care.